Dr. Bobinet, thank you so much for joining me today. I was reading that your work really focuses on patient engagement.
Yes.
And I've heard that a lot as kind of like a buzzword, but what does it actually mean?
To me, it means that people have the confidence, the ability, and the drive, and the psychological hope that they can make a difference in their health and they can be in control of their health.
You're a physician by training, so how did you get interested in this type of work?
So my last patient that I saw clinically had a gouty toe because he had been up on 3 days from meth, doing meth on Sunday. And I saw him on a Wednesday, and I was writing the prescription for the gout, and I said, this is not the conversation I want to have. I want to help him with the meth. I want to help populations, move in that direction. So I went to public health school and decided that it was, my gesture, my contribution to the world is really about having the conversation around what holds us back from taking full control of our health.
Can you make that change even if you are still immersed in clinical care?
My point of view is that medical school is missing the patient engagement and behavior change curriculum. And so this fall, we have a massive online course here at Stanford that Larry Chu and I developed. It was a class that we live streamed at the beginning of this year, and he's turned it into a massive online course for others. So we're hoping that that becomes accessible to anybody in training along, first-year medical students all the way through, full practicing physicians, because we do believe that the entire physician community needs to be really good at patient engagement and behavior change in order to make a difference in people's health.
Can you give us an example of one of the concrete things that you might teach physicians in training?
My ideal would be that people would understand the process by which the brain takes in new information, develops it over time, the neuroplasticity that happens, and more importantly, the relapse and what that means, being able to interpret that.
Why do you think this is something we aren't already teaching in medical school?
I think because there's a lot to go over in medical school. There's so much, there's a boom of science, there's a boom of genetics, things that 20 years ago when I went, we didn't even have to memorize that stuff, and it was already too much, It was already broken up into multiple years and multiple boards. So there's a breaking point here where we have to make some trade-offs about what we're going to automate and give to, kind of artificial intelligence type systems and the Watsons of the world, or the algorithms of the world, and what we're going to ask the humans to carry, which I think is the relationship. I think it's the motivation piece. I think it's being able to read a person and know what is true for them and what is right for them.